Good evening, televiewers, and welcome to yet another exciting edition of our program Mountain Echoes. Today, the 13th of May, 2025, barely 1 day and some hours that we're going to join the 6th Monsignor in the Diocese of Boya to celebrate the Thanksgiving and investiture ceremony with the Lordship at the Co-Cathedral site precisely at 9 a.m. That will be on Thursday. Of course, we shall be throwing more light on that tomorrow, Wednesday in the evening. You get maybe points from the Monsignor themselves and maybe other things that will be necessary for us to maybe listen or maybe to get from them. Basically, it's all publicity telling us and inviting us. Invitation is open to all of us to come and join and see what is happening this time around the Diocese of Boya. Since its creation, we've never had maybe that. If we had that celebration, some of us were not born. And we have 6 this time around. The number has never been like that before. And we come and see what will be happening there at 9 a.m. on Thursday, the 15th of May, 2025. Exactly, with the Bishop of the Diocese, Bishop Michael Bibi, the main celebrant and the presider over that ceremony. Today, we shall be looking at these health issues. Remember, we said Tuesdays we designated for health issues. We'll be looking at cancer and some other kind of stuff, health issues, because the healthy person is a wealthy person. Today, we shall handle these hepatitis B or hepatitis B, understanding the virus and its transmission routes. Of course, we cannot be talking about health issues without health personnel or health experts on sit. That is why we have our brother and friend, Dr. Brandon, said fuck up. Doctor, welcome and good evening.
Thank you very much, Reverend Father. Good evening. I am very happy to be here to participate in this educative session to share the little knowledge I have about health with with the world.
Thank you very much, because DMRO TV, especially our program Mountain Echoes, is said the most. We have the highest viewership. You know, people that we presume everybody's at home, they are glued by their TV, and they know that Tuesdays have been kept aside for health issues. And like I said at the beginning, a healthy mind or a healthy person is a wealthy person. You do not go to the hospital, you do not complain of malaria, you sit and you move around. The one who is always sick is not a healthy person. And so when health is concerned, and it's for free, of course, we, like yesterday, we made mention of the fact that on the TV we entertain people, maybe having some kind of program like dancing, mass, singing and the rest. We equally educate people. We equally educate people. We do not only educate people, we inform people of what they ought to know. Some of them do not have the opportunity. So we have those things down there, and today is one of those days that we come to educate people as far as health is concerned. And by my right, we have Mr. Ray Sebastian. Good evening and welcome.
Good evening, Father. Thank you for this edition, and thank you for making it a reality. I'm overwhelmed being with you today. Being a Catholic and also being a medical practitioner, I'm overwhelmed sharing this the practical side of this transmission of this virus.
Yeah, thank you very much for accepting the invitation. And of course, we have Madam Ngong Maureen. Thank you for taking initiative, asking Father Cool, some other persons join us, thank you for coming, and thank you for accepting the invitation, and good evening.
Oh, thank you so much, Father. It's really my pleasure and joy to share with the community, to know about what hepatitis B is all about, mode of transmission, and how to prevent it. It's really our joy, because when you look back at the community, many people are suffering because of ignorance. So today, we'll make the community or the population to know what it's all about and how it can be prevented. They always say prevention is better than cure.
Yeah, thank you very much. Yeah. I've been hearing that since from the kindergarten days. I don't know, Doctor, maybe you had that kind of, that prevention is better than cure. Until I grew up to be a mature person before I knew about maybe the reality of that. We just thought maybe it was a kind of a saying in the neighborhood, in the quartier. Prevention is better than cure. Your mother will hold your ears until So we kick the ball rolling, and this is all talk about hepatitis B. Many persons are so scared about that. And want to go for maybe the test and the rest. So what is it all about in summary? What is hepatitis B?
Okay, hepatitis B, a very interesting viral infection caused by DNA virus, which affects the body, specifically the liver, the liver, which is a very important organ in the body. The liver is the organ that helps to process a lot of things in our body. I hope it helps to clear waste, helps to digest food, converts a lot of things. So hepatitis B is a viral infection that affects the liver and destroys the liver. So if you destroy an organ that processes a lot of things in the body, converts a lot of substances into useful substances, and clears out waste, then definitely you're going to have a problem. So, and this hepatitis B, it's funny that it's not known to many people. Still, as much as we think that people are aware, so many people in the consultation office, you're going to have so many people that will tell you that hepatitis B, I'll say as a respond in pidgin, say that now we see how did the get me that thing they so the people know of HIV, yes, but they do not know that it's easier to contact hepatitis B than to contact HIV. So hepatitis B is a disease that affects almost 300 million people in the world presently as per World Health Organization statistics, and it's surprising to know that it kills 1.5 million people every year. So this globally, so this is a call for concern. This is a very big call for concern, because if you have a disease that takes out this number of people per year or affects up to 300 million people as per current statistics, that means that, and it's a disease that can be prevented, that means that something is going wrong. It's a public health emergency that we need to look into.
Yes, doctor. At the end of this whole thing of hepatitis B, someone is equally making mention of the fact that it can lead to maybe a liver failure or liver cancer. It's so frightening. So, what do you tell the public or the viewers of of Mountain Eagles?
One thing about medicine is that medicine has big names, and I think these big names frighten our population from the basic things that would have helped. When they just hear these names, they're like, no, me I know if they'll say me I know if you go me hospital. Small time they talk say, oh this liver failure, as per the word itself, it means the liver has failed. It means the liver is not performing the function that it's supposed to perform.
Can that be corrected?
There are stages of liver failure. Generally, at the beginning of liver failure, you can solve the problem and reverse. But when you get to what we call cirrhosis, that means that the liver is gone.
Cirrhosis,
cirrhosis or a liver cancer. That means that the liver is gone, and the only way out is a liver transplant, which you mostly have that for now, but in the Western countries and so on, or in some African countries. I don't.
Cameroon has not got that.
Not necessarily. We do a kidney transplant. For liver, I am not sure, but I still, maybe I can be corrected.
Anyway, doctor, we come into that. Mama Maureen, what could you add maybe still on this hepatitis B? It's not news to us that you've been working with many persons when they come for the tests and some other kind of stuff for years now, back there in the hospital in Solidarity and some other hospitals and maybe some other places you found yourself in Cameroon and out of Cameroon. What do you tell the viewers as far as this hepatitis B is concerned, and maybe added to what Dr. must have said already?
Okay, to add to what Doctor has just said, we would like the public to know that hepatitis B virus is for real. Because many people in quotes, when they have it, you start telling them, they start thinking of witchcraft and other things put in place. While at the hospital, you see clients, they come, maybe as a family, we want to get the vaccine. We say, no, before you get the vaccine, you have to get yourself tested. Okay, but how much do you know about hepatitis? What actually made you to come for the test and other things in place? That's when you start getting some stories. My uncle, my husband, our neighbor died of hepatitis B. And it was so frightening in such a way that we thought we could get ourselves tested and be vaccinated. So the idea behind is really a type that we need to make the community or the population of Boya and at large Cameroon to know that it's a very serious virus, that you need to know your status. Knowing your status is better than not knowing, because by the time you come to discover, it may be at the later stage, just like what Doctor just mentioned, and at that level it will be difficult to manage. But if you know it when it's earlier, it's easier to manage.
Yeah, thank you very much, Mama. I'm sure maybe Mr. Ari Sebastian is working in the hospital also. You might have come across some persons who either they came and maybe share their experiences with those who maybe before the test or some maybe after they conducted the test they realized that the patient. How did you maybe what do you tell the viewers about that?
Thank you, Reverend Father, for that question. Working in the hospital, first of all, I'm dealing with for the life of the mother and the baby that is at the maternity.
Yeah.
So it mostly come in contact with these pregnant women. When getting tested, you will see them positive. Now we have a vaccine that we always give to prevent mother-to-child transmission during birth, during childbirth, or during breastfeeding.
Breastfeeding, yeah.
So that vaccine is usually very expensive and difficult to find. So most pregnant women, when they come in that early age, might be 26 weeks or 24 weeks of pregnancy, we get them tested, or we ask them if it's positive. We ask them to buy the vaccine at once to prepare, so that when they put the time that they put to bed, they will not go about looking for the vaccine to vaccinate the baby. Now, I'm telling viewers around the world, especially in Boya, and those who are watching DMTV, sorry.
Especially Mountain Echoes, this is
Now, most people take hepatitis B very, very neglected. They take it for granted.
Yeah.
You see, even us footballers, when we go to the field training, you see somebody just remove the t-shirt, gives to the friend.
Maybe the captain, but some of us love being captain.
Because
Dr. Brandon also love being captain.
We don't. Many of us don't know that that virus is being transmitted through bodily fluid, like coming in contact with an infected person through sweat and all that. And going back to the maternity where I belong, so mothers who are born with mothers of hepatitis B positive, after birth, we make sure we get the babies vaccinated within 72 hours. This is to prevent mother-to-child transmission of hepatitis B virus.
Okay, thank you very much, Mr. Sebastian. We're talking about all this. I think maybe we could look at we'll look at the causes. Dr. Brandon, could we look at the causes and look at the causes, and after that maybe we could throw more light and then move to the symptoms of it and how it's been maybe transmitted to other persons. So how does the virus affect the body? But look at some of the causes of this hepatitis B, because like Madam Robin said, it's not news to us that many of us out there we attribute some of the causes of hepatitis B to village people, witchcraft, and we go to some of the pastors and some of them are the so-called prophets, that they'll give you maybe olive oil to clean out the hepatitis B. Yes. By the end of our program, we'll be telling them the right things where they ought to go to. We'll not refuse that God doesn't work through those persons. We're not saying so. God can use one material to pass across a particular message. He could use Dr. Brandon, for example, to heal somebody. But of course, he's still the one who gives them the intelligence to be a doctor. So those who are doctors, they have their role to play. The pastors also, they have their own role to play. So issues that are health issues, they should channel them to the hospitals. Issues that are spiritual, should channel them to the priests or pastors and the rest. So Dr. Brandon, move over looking at the causes of this whole thing of hepatitis B.
Thank you very much, Father. You see, you've put up a very important point that we face in the health field, the difficulty of who to channel what to who. I think that our field every day is being attacked because people tend not to separate the spiritual, even the physical disease. I usually ask some of my patients, do you think that it's the devil that made doctors? Doctors were made by God. The hospital was made by God. So it's not for some people and left for others. Okay, with respect to the various modes of transmission, as my brother Sebastian said, it's bodily fluid. It's fluids. Now, fluids is a word that encompasses a lot. In terms of fluids, there are three main. There are other minor, but in terms of main, there are three main. You have blood, which is at the top of the chart. Blood-to-blood transfusion, which you can get, you see, like in pregnancy, during delivery, mother to child, especially during delivery. You can have that when someone is transfusing blood. That is why hepatitis B is one of the tests that we do when we want to collect blood for transfusion. You must screen for hepatitis B. So blood-to-blood transfusion. You also have semen. and you have vaginal secretions. That is why they will classify that under sexual, unprotected sexual intercourse. Now, so these fluids are the main. Now, there are other theories about bodily fluids like sweat, like kissing. Yes, but the issue is that the percentages with this are very, very low, less than 1%. So most of the time, you don't see education being done a lot on that. You see people focus on the 99% where you have the blood and where you have the vaginal and the semen. Yeah. So the main methods of transmission are with respect to that blood. And even when somebody tells you about kissing, I always tell people that what you see in that theory, they'll tell you that if I have a wound in my mouth and maybe we are kissing and blood comes out from the wound, and you also have a wound in your mouth, and then there's some blood to blood. Yes, but the main methods are through maybe blood transfusion, mother to child, sharing syringes, razor blades, just like HIV. The hepatitis and HIV have a lot of similarities.
So there's a kind of a mix-up somewhere. There are many persons some persons whom, when it is being discovered, or maybe when they have maybe they are patients, or maybe they've been infected, or they call them maybe with hepatitis B, or that's attributed to HIV. What was the link between these two?
HIV, is also a viral infection.
Yeah.
Yes, HIV is an what we call RNA virus, and hepatitis a DNA virus. Now, the issue is that HIV and hepatitis are two diseases that you don't actually cure them. I'm talking about hepatitis B, because there are other types of hepatitis which can be cured.
Okay.
Yes. So HIV and hepatitis B are similar in such a way that they both are by viruses, and you don't cure them, and they have similar modes of transmission. And people don't really have a lot of knowledge on hepatitis B, so it's easy to attribute, because when you tell somebody that you have a disease which cannot be treated, which cannot be cured, it can only be treated, but it cannot be cured, the first thing is HIV. So people believe, and also you have a lot of what we call HIV hepatitis B co-infection. Why? Because the people who easily pick hepatitis B risk factors are those who are commercial sex workers, those with multiple sexual partners, and in these people you have a lot of those diseases together. You have HIV, one person will have HIV hepatitis B. As you're a commercial sex worker, you sleep with A today who has HIV, you sleep with B today who has hepatitis B, you sleep with C today who has hepatitis C. So you mostly find this co-infection. Yes, this co-infection is very, very common because of the risk factors around this hepatitis.
Okay, thank you very much, Doctor. We'll be coming back. We need to pay more attention on the cause of hepatitis B, but then we realize that when we talk about hepatitis B, to presume that maybe there's something like A or C. I don't know if Mama will just say something about that. There are other types of hepatitis. Maybe there's B, therefore there is A, maybe there's C or D. Could you just tell the public about that?
Yeah, actually we have hepatitis B, we have C, and we have A.
Yeah.
A is not common in Africa, but C is common. C is being cured, and B is not cured. B is just treated. That's the difference. The modes are all the same. And there is one thing the public has to understand. It can only be gotten through an infected person. You can have this body contacts, all of that, but if the person in question is not infected, you cannot pick up the virus. You pick it only through an infected person. That's why, as Dr. earlier said, you can get it through footballers. When they play, they hit themselves, they fall, they have bruises, and they have this body blood contact. School children, when they play in schools, and so on and so forth. Medical personnel as well, when they are handling or dealing with them, infected persons, when you are picking up, when you want to collect samples from them, you may have this accident of syringe or blood spilling on you. When you have wound on your body as well, it's easy for them to pick up this virus. So A, C, and B is the same, but B is the worst part of it because it has no cure. C has a cure. A is not common in Africa.
Okay, maybe Dr. Yusuf, maybe Mr. Sebastian.
Yeah, adding to what my grandma just educated the population on, I would like to dwell more on A and C.
And A and C,
C, we usually say is being caused by food poisoning. The hepatitis A virus, usually caused by food poisoning. According to an article published by WHO 2019, we saw that most of our diseases come from the food we eat, specifically hepatitis A, which is being caused by food poisoning. And we also have alcoholic hepatitis. Those are other types of hepatitis. These are the types of hepatitis that is being caused due to too much induction of alcohol. When you too much drink alcohol, consume alcohol, these fatty tissues are being accumulated in your liver, causing liver cirrhosis, as Dr. earlier mentioned. So saying that hepatitis B is being caused by the hepatitis B virus, and the mode of transmission usually through bodily fluids. So I'm also saying that hepatitis A and C is usually transmitted or is usually caused by food poisoning.
Doctor.
If I can add something, we actually have A to E.
Wow.
So you extend to E, and in the E we have B, C, and D, who are brothers, and then we have A and E that are brothers. Actually, it is A and E that have the food aspect in it, the food aspect. But you hardly see A and E in Africa, as they said. You hardly see it. You're going to mostly see B, C, and D. And B and C are similar in mode of transmission. All these body fluids, blood contact is the same thing. Yes. Why D is not very common, but D most with B. Whenever someone has B, it is very easy to pick hepatitis D. Yes, but D you hardly hear because there is no vaccine for D. As we heard from Madame Maureen, you have a vaccine for hepatitis B, no vaccine for C, but C can be cured. That means cured and the virus goes away. But mind you, C is the biggest killer among all the hepatitis.
So could you maybe expatiate on that? Maybe this is frightening because we knew of hepatitis B.
Yes, so but C is actually the biggest killer, but C is not very common too. Hepatitis B is the most common hepatitis. That is why it is considered a public health emergency, because what you see in most people, C you're not going to see very much, but C is what is going to kill the patient very fast. But C can be treated. That is the glory of it, because you can actually treat it and wipe it. You can cure it. We use the word, when we use treatment means you're giving medication and the viral load is not increasing, it's decreasing, but it doesn't disappear. But when we say cure, it means that the thing goes away 100%. So C is the complication of C is what is the problem, because C will cause you liver cirrhosis faster than B is going to cause, and C is going to cause you liver cancer, hepatocellular carcinoma, simply called liver cancer. So many people are not aware of C. So when we have clients who come to the hospital, sometimes they are like, doctor, I want to do tests for hepatitis B. I always advise them also do for C. But the issue with C is that unlike B can stay with you dormant for so many years. You can die at 90 with hepatitis B without knowing that you had hepatitis B, because it can stay inactive. So, but C does not stay inactive. C gives you symptoms. That is why C is not talked about very much, because once you have C, you're going to start having symptoms with time, and they'll diagnose it. But B can just be there quietly and is spreading from one person to another. But to see somebody with hepatitis C is not very common, but the treatment is there and you can be cured 100%.
Could you just say maybe you have something to add as far as how the virus affects the body before we move?
Yes, the virus affects the body by destroying the liver cells. And how does it destroy the liver cells? It's a very basic mechanism. When this virus enters into your body mounts what we call an immune response. Your body tries to fight. The
white blood cells, if I'm not making a mistake, they are the soldiers, right?
Yes, the white blood cells are the soldiers of the body, and they produce what we call antibodies. These antibodies are what fight every infection that comes to our bodies. So your body mounts an immune response to go and fight. Now, what happens? This is actually stage 2 of when you have hepatitis. An immune response is mounted. What And that immune response is only mounted after the virus has entered your body and starts replicating. So your body is like, no, something is going on that is not supposed to be. Now, a reaction between the immune response, the antibody, and the virus, that reaction produces a lot of toxic substances. We call them immune complex. These immune complexes are what destroy the liver cells. So the liver is destroyed as a collateral damage from the battle between the hepatitis B virus and the antibodies. And now, once the liver cells are destroyed, it's like you're destroying the active workforce. The liver cells are destroyed. The liver cannot perform its function. You start having complications like what? Waste product starts accumulating in the body. And these waste products that accumulate in the body, they go to every part of the body. They go to your brain. They give you what we call hepatic encephalopathy. That means that you have a brain problem because of the liver. Yeah. They go to your kidney. They give you what we call hepatorenal syndrome. You have a kidney problem because of your liver. They drop to even the intestines, even blood flow. So the liver is like, in quotes, the Bambi of the body.
Yeah.
So if you take away that Bambi, if you destroy that Bambi, yes, and it's like every workforce, there are people who are on the ground, yes, even like a boat. You see a boat, there are people, when you watch old films, there are people down under that paddling. That's the liver. Yeah. Is that hidden organ that is there doing everything. Eliminate those people and the boat can no longer move. So technically, that reaction destroys the cells, and as it destroys the cell, waste product accumulate. You start swelling up. You start having jaundice, you start having a lot of problems, brain failure, kidney failure, and so on, and it goes on and on and on.
Yeah, thank you very much, Doctor, is for all these educative maybe talks and maybe guides for the public. We'll be calling on JC. There's something for us. We have that for 1 minute 30 seconds. If the first video is ready, we could have that before we pick up to the other section of our program. Like we said today, understanding the hepatitis B, understanding the virus transmission routes. That's what we've been looking at. A healthy mind is a wealthy mind. A healthy body is a wealthy body. If, like doctor said, if the liver is overworked or maybe kicked out, many things will fall apart in our bodies. Jesse, if we have that, we could take that.
And I'm the medical director of Let's Get Checked. I'm here today to talk to you about hepatitis, namely hepatitis B infection. So what is hepatitis B? Well, there are a number of different types of hepatitis infections, and B being one of them. So there's also hepatitis A and C and D and E infection, but today we're going to talk about hepatitis B. So hepatitis B is known, or what we call in medicine, in medical terms, is a DNA virus, and it affects the liver predominantly, leading to a condition called hepatitis, which is inflammation of the liver. But how is hepatitis B transmitted? Well, hepatitis B is transmitted in a number of different ways. The first way to mention is through unprotected sexual intercourse, and this could be oral, anal, or vaginal intercourse. The second way that hepatitis B can be transmitted is through the sharing of needles or infected medical equipment. The third way that hepatitis B can be transmitted is through infected blood products. The fourth way that hepatitis B can be transmitted is through sharing of items such as razors or toothbrushes, because hepatitis B is also found in saliva. So what are the signs and symptoms of having hepatitis B? Well, the good news about hepatitis B is the vast majority of us, if we get infected with it, our own immune systems clear the virus. But in a small minority of patients, they become chronic carriers, so they have a chronic hepatitis, so the virus is always active in their bloodstream. So signs and symptoms of having hepatitis would be, you may have a flu-like illness, you may feel like you've got a very severe flu, you may be suffering from extreme fatigue, you may develop abdominal pain, particularly in the right side here where your liver is. You might have liver pain, and you might develop signs and symptoms of jaundice, which is classically the yellowing of the sclera of the eyes. And you may develop a severe itch, and this is also due to jaundice. So they're just some of the signs and symptoms of having hepatitis B. So how do you go about getting tested for hepatitis B? The only way of getting tested for hepatitis B is by having a blood test. What are the complications of hepatitis B? Well, as I mentioned, most people, most of us clear hepatitis B ourselves, and we don't carry it chronically. We don't become chronically infected with hepatitis B. However, for the small minority of patients who do get chronically infected with hepatitis B, it can lead to very serious complications. Those complications, as I mentioned, include hepatitis, which is inflammation of the liver. If hepatitis continues unchecked or untreated, it will lead to a condition called cirrhosis. This is hardening or thickening of the liver, and the liver stops functioning as it should. And it can also lead to hepatocellular cancer or cancer of the liver. If you're concerned at all that you've come into contact or you've been exposed to hepatitis B, or indeed you might have hepatitis B infection, please visit our website and let's get checked and speak with one of our nurses, and they'll advise you with the best test that is suited to your needs.
Thank you, JC, for that. It was just kind of a summary of what we've been discussing here. For those who were not with us at the beginning, they forget that was just a resume of all that we've just discussed here. At the beginning, Dr. Brandon made mention of most of those things, Madam Maureen and our brother here, Mr. Ari Sebastian, for that. There is this whole thing of, we're talking of when you made mention of the fact that when the liver is gone, what are some of those things we could put together to ensure that the liver is still there, the liver stays there? Like maybe you have your vegetable, or maybe beside your house your little garden that you could add humus on it, or you could pour water time and again. It is dry season, you make sure that you weed the place, the grass for me to to ensure that everything is in charge or in order. How do we do that? Maybe to prevent the liver, or maybe to guide the liver, maybe from this kind of maybe malaise, so put it like that.
Okay. Well, if you have hepatitis and it has gone to cirrhosis, the liver is gone. It's gone. Now the treatment there is liver transplant.
Okay.
But when you have now I'm going to talk about things that can make the liver reach cirrhosis faster.
Okay.
Or things that can prevent the liver from getting to cirrhosis.
Okay.
Yeah, so that's where we have, let's assume that we have a client with hepatitis B infection.
Yeah.
What are some of the ways that he can prevent himself, him or herself, from getting to cirrhosis? Hepatitis is inflammation of the liver. Now you can call it hepatitis B, or mean that it's the B virus. You can call it hepatitis C, the C virus. You can call it alcoholic hepatitis, that means it's alcohol.
Okay, doctor, before this explanation you come back, I remember Mr. Sebastian talked about alcohol.
Yes.
Could you just tell the viewers, the public, especially some young people, more of them are into it, and even some of our older people. Sorry to be biased this time, Madam Maureen, I'm talking out of I did some work on that. It is no news to us that some of our parents, especially our mothers, sorry to say that, they are like taking the lead. Not everywhere, but in Boya and some other places, we cannot really give an estimate, maybe number of those, but a good number of them, without exception, they take pleasure in drinking alcohol. Could you just say something about that? Because you made mention of one of the causes is high consumption of alcohol. If someone tells you that it's only after 6 bottles before he or she, consider himself or herself, start drinking with a lot of pride. Could you just tell them?
It's you're not wrong. We have, when people hear of alcohol, they think there's only beer.
Yeah,
that's the problem that we have. So when you say maybe women drink alcohol, tomorrow, no, even the sha that we drink, even the white wine matango, is alcohol. So alcohol is not only the beer that is sold in the bar. Okay, now with alcoholic hepatitis is one of the most common forms of hepatitis. And alcoholic hepatitis is this one. Now you take your money and you inflict yourself the pain. Alcoholic hepatitis comes as a result of excess consumption of alcohol to the liver, and this alcohol destroys the liver cells. Now as per WHO, there is a limit to the consumption of alcohol that you're supposed to have per week. Yes, there's a limit. If you can stay without consuming alcohol, that's fine. But if you're supposed to, and the WHO gives 21 units for men and 14 units for women. These units are calculated using a particular formula of the percentage of alcohol, the quantity of the bottle, and so on. But this limit is meant to keep you safe. For people who have hepatitis B, they have to avoid any other form of hepatitis, because any other form of hepatitis that they have will trigger the replication of the virus. So they have to reduce the quantity. They have to avoid. They don't have to reduce. They have to, as much as possible, avoid drinking alcohol. And this is where we have a problem. You see, the person who is infected with hepatitis B may be a commercial sex worker who drinks a lot of alcohol and takes a lot of drugs. Hence, will have hepatitis B, alcoholic hepatitis, and even what we call drug induced, because even medications can cause you hepatitis. So alcohol hepatitis is hardly on its own. It always comes, you know, these things are like, it's a whole package that come together because the lifestyle favors it. So when we have a client with hepatitis B, you find out early, you're still healthy, you have to make sure that if you're consuming alcohol, you stop. You have to make sure that it has been proven that a lot of consumption of uncontrolled medication, whether it is traditional or it is conventional, will also cause drug-induced hepatitis, which will destroy the liver and promote the replication of the hepatitis B virus. So the person needs to avoid alcohol, avoid buying medication without medical prescription from a doctor. The person needs to eat a lot of vegetables. The person needs to exercise a lot. You must be healthy. Exercise a lot, drink a lot of water, and so on. And you must prevent other co-infections, because once you pick up HIV, for example, it still worsens the hepatitis. So to save your liver, you have to prevent yourself from things that destroy your liver. And there are two main things: alcohol and drugs. Drugs here are a group. It can be recreational drugs, it can be traditional medications, and it can be our own conventional medications. Just like people with hepatitis B are not permitted to take a lot of paracetamol, because paracetamol is one of the drugs that destroys the liver a lot. So it can give you drug-induced hepatitis and your virus starts multiplying. So clients like this, there are a lot of things that they have to avoid to stay healthy. And if they avoid these things, trust me, they are among the population that they are going to stay and maybe die at 70, 80, 90 without ever having the symptoms or the getting to that liver cirrhosis, getting to that hepatocellular carcinoma. It just needs you to avoid these two things: alcohol and drugs.
Thank you very much, Doctor. Then you had a very salient points that you came up with before I brought in this whole issue of alcohol. The course of talking, could you maybe expatiate on what you had? You're talking of how maybe to prevent the liver from blah blah, or maybe to get, if the liver is already, how do we get that?
If the liver is to prevent, as I said, you vegetables, drink water, exercise. If the liver is gone, it's a liver transplant. But the amazing part about the liver is that they can cut out a part of your liver. The liver is an organ that has parts, so they can cut out a part and leave another part if one part is affected, or they can cut a part of liver from somebody and give you. Just as they remove one kidney and give you, they can actually cut a part of the liver and give you. So a transplant does not mean I take a whole full liver, but of course the person will not be functioning with a full liver. So just like a kidney, the person has to be very careful not to misuse the new liver. And that is one of the ways of curing hepatitis B. Remove the liver, because that's where the hepatitis is, and then you bring in a new liver.
Maybe Madam Maureen, you have something to add on that.
Actually, one of the best modes to prevent hepatitis B, when you get yourself tested and you are negative, it means you are eligible to take the vaccine. There is a vaccine for hepatitis B only for persons who are tested negative. If you are positive, you cannot take this vaccine. And this vaccine is taken in 3 phases.
Yeah.
You have the first dose, 1 month after you have the second dose, 6 months after you have the third dose, 1 year after you have to get yourself tested. If you are tested for this hepatitis B, which is the panel which you are being tested of, to be sure that you have the immunity in you, your result has to be positive. If it is negative, it means it's not enough for you to think you already have the immunity in you. And if so, you still have to take another 1 year vaccine. That's one of the best mode of prevention of hepatitis B. And I know many people will be asking, where can I get this vaccine?
Yeah.
Because they don't even know that there is a vaccine for that. You come to Solidarity Clinic at Moliko, just a checkpoint opposite Ename Pharmacy. There the clinic is. You get yourself tested, and if you are negative, you'll be vaccinated. You start the calendar of vaccine. And more of this will be highlighted on the client.
Yeah, okay. We can back to Dr. Brandon. Someone is still insisting, what is hepatitis B and how does it affect the liver? You know, there are many persons who are not aware of this whole particular virus. So, you know, they attribute it to witchcraft. Some maybe may think that maybe it's HIV. Others may think that it's cancer, and the rest are not too sure of it. Could you just throw more light on that?
One of the easiest ways to describe what hepatitis B is an infection just like HIV.
Yeah.
It's a viral infection like HIV. It has similar modes of transmission to HIV. Blood, infected needles and razor blades, unprotected sexual intercourse with infected persons. And how does it affect the liver? Hepatitis B, once it gets into your bloodstream, the virus, where it stays, where it lives, is the liver. So it has, because all the blood in your body passes through your liver, all the blood in your body. So the hepatitis goes there, it enters the blood, as it's moving, as it gets to the liver, it stays there. Now, when it gets to the liver, it stays there, it starts replicating slowly. That means it starts dividing. It starts dividing slowly. And when it's dividing slowly, your body immediately mounts, because anytime that you have an infection, just like when you have a little typhoid fever, when you have cough and catarrh, any infection, your body mounts an immune response. That means your body mobilizes its armed forces that we are going to go and fight the battle. Now, what happens when your body mounts this immune response? Your body goes to the liver, sees the hepatitis that is there. 2 things can happen. The first one is that your body can actually destroy the hepatitis and you will not have hepatitis. You can have an acute hepatitis and you're free. Please, it's important to note this. You can get infected and your body destroys the virus 100%. It goes away. Or if it enters what we call the chronic stage, that means that some of the virus is not destroyed. Your body tries and tries and tries and destroys some, but some persist. Those ones that persist stay quietly. They are just there.
They're dormant.
They are dormant.
Yeah.
Either they are multiplying slowly. They are waiting. They can be there for 10 years, 20 years, waiting for an activator. Waiting for you to drink alcohol and have alcoholic hepatitis. Waiting for you to take a lot of drugs uncontrolled, like we have now. People just buy drugs without medical prescription, waiting for you to do those things, waiting for you to take these recreational drugs, and then you start damaging your liver. Then they start replicating again. So hepatitis goes to the liver because it wants to multiply there. When it multiplies there, it destroys the cells of the liver. So your body goes to mount a response. Either your body destroys it totally, or some of it is left to give a chronic hepatitis. So there's acute and there's chronic. Acute is a short term, and your body destroys it and it's gone. Or chronic, where it stays. And with chronic nowadays, we'll get to the point, I'm sure we'll talk about treatment and how the treatment of it goes. So that is how hepatitis comes about to, that is how hepatitis comes to destroy to destroy the liver. And I will just bring up a point with respect to the vaccine, as Madame Maureen was talking. The vaccine is very important. Yeah. And there have been modifications with respect to the vaccination in terms of there are other vaccines that have been added to the traditional 3-dose vaccine that we have. I think now in children, in the expanded program of immunization, that means the normal vaccines that children take, hepatitis B is part of it. They give them, and this program was introduced in 2005 in Cameroon. It's an old program, but Cameroon welcomed the initiative, the Ministry of Public Health, in 2005. And they noticed that they give you a 3-dose on when mothers go for their 6 weeks vaccine for their babies, 10 weeks vaccine, and 14 weeks vaccine. There are some vaccines that they give at 6 weeks, 10 weeks, and 14 weeks. And hepatitis is one of them, hepatitis B in particular. The vaccine is there. This alone was proven to drop the percentage of hepatitis from 11% that we're having to less than 1% in children. So this is, and just I think February 2025, the minister signed a document implementing another mode of vaccination, which is already in place in some hospitals, vaccinating the newborn. That means at birth. Hepatitis B vaccine at birth, like they give polio. Yes, a start dose of hepatitis B vaccine at birth. Whether the mother is negative, whether the mother is positive. Yes, this measure was brought in 2005, in 2025, this February, and it is still to be implemented in certain health areas. But this is done in certain countries in the West, and it really helps to curb down. So whether they did the test, because even when you do the hepatitis test, you do it when the woman comes for work or booking visit. That's this. But what happens after 6 months of pregnancy? Because we don't redo this test when this woman is delivering. What if she has picked up the hepatitis during that period? Because some women still have sexual intercourse when they are pregnant. But if you have a habit of giving the start dose of the hepatitis vaccine at birth before you're going to the 6 weeks, for 10 weeks and 14 weeks, and then before you even give, if you still want to give the traditional 3-dose that we know, all of this will help to curb down the incidence of hepatitis a lot.
Doctor, you talked about acute hepatitis that can be, is it treated and the rest. Is there a possibility if that is being handled, can it come back again? Is there a possibility of someone having it again, maybe?
Yes, you can have a relapse, and that is what now we call chronic. That means that when the hepatitis came and then your body was fighting it, you're going to have fever, you're going to have jaundice, you're going to have what we call prodromal syndromes. When your body eliminates this virus, you can be free. Like after the acute phase can last for like 3 to 4 weeks. And then everything goes back to normal. But when everything has gone back to normal, you cannot know. Because you can either have a case where your body has totally eliminated this virus and you're free, or you have few that are hiding somewhere inside there, just waiting and waiting and waiting. But with time, there are tests that you do that can tell you if it's still there. And if it's still there, there's nothing you can do. So the only chance that you have when you get in contact with hepatitis B is if your body is strong enough to mount an immune response to fight it and eliminate it on its own. It's not with medication. It's your body, if it's strong enough. Once it gets to chronic, there are methods of treatment which maybe we may discuss as we go ahead.
Doctor has been speaking for so long. Madam Maureen, could you maybe throw more light on that? Someone is still equally asking what are some of the main symptoms of hepatitis B. Maybe you see someone, if he or she is tired, or maybe the eyes are red, that maybe something is wrong. Could it be some particular things that when you go, hey, there may be something there. It's high time, I'm in the hospital, find myself in the hospital, go to the hospital. What are some of those things we go place our hands, if there are any?
Okay, Father, thank you once more for giving me this opportunity to tell the general public on the signs and symptoms that if you find them in you, it's better you rush to the hospital to know your status. You have loss of weight. You have edema. You have jaundice.
Yeah.
You have dark urine. You have loss of appetite. You have nausea and vomiting. You also have fever, headache, and many others, just to mention a few. If you have 3 or 4 of these symptoms, you have to start thinking of, maybe, in quotes, I have hepatitis B virus. And the only way to do is to go to the hospital and get yourself tested. Other things may be in place, but trust me, with 3 or 4 of this, the virus is present in you.
Yeah, maybe Mr. Sebastian, do you have something?
I
Maybe you
think
could explain more, yeah, or add, and then maybe you expand on any of the signs and symptoms of hepatitis B.
Okay, thank you, Father. Adding more like what Madam Maureen just said with respect to the signs and symptoms of the hepatitis B virus. Most, as she said, you heard of the dark color urine fever.
Yeah.
Most people will not understand. They will think that it's just like dark. The urine appears like color of a Coca-Cola.
Yeah.
Yeah, Coca-Cola color. And then jaundice. Jaundice is a medical term. This is a medical term which simply implies that the skin, there's yellow discoloration of the skin, because this virus happens to destroy liver cells, and the liver is where red blood cells are being produced. So when this virus attacks the red blood cells in the liver, it destroys the red blood cells, causing jaundice. And sharp pain, as we saw in the video, saw the doctor demonstrating sharp pain around where the liver is being located. And we have some general signs and symptoms like fatigue, nausea and vomiting, and what Madam Maureen said, edema. Edema is just a medical term which simply means swelling legs. Due to organ failures, and the liver, since the liver is an organ that helps to detoxify drugs, because that's one function of the liver, detoxify drugs and remove wasteful products. So edema can result as a result of accumulation of waste, as Dr. Ella explained.
Yeah, this will go to Dr. Brandon. Swelling in the abdomen or legs, and some persons at times they used to say, like you quoted one, you explained one thing like that at the beginning. In the local parlance, you see some man don't match poison that it's in food don't swell and the rest. How could you explain that to the public? Some persist for a very long time, and it is not. That some cases, that some of them, it's not hepatitis B and the rest. How can someone really place his or her hand to know that this maybe swelling in the abdomen or legs is hepatitis B?
Okay. Sincerely, Father, it is difficult to pinpoint if it is hepatitis B. You can know that it's a liver failure, but to say that this swelling in the abdomen or in the leg is hepatitis B in particular is difficult. But you know that this is a liver failure, and if you have a liver failure, then these are the tests, or these are the causes of liver failure. I will start a little bit with the symptoms. Hepatitis B, as Madame Maureen said, she mentioned symptoms. We call some of those symptoms constitutional. Somebody will wonder that fever, headache. That means that even this malaria that I think that I have, I should not think that it's hepatitis B. They are called constitutional symptoms because those are symptoms that have whenever you have an organ that, when there is disruption of that organ, the whole body is affected. You're going to have those constitutional symptoms. Nausea, vomiting. It's the same with HIV. Yeah. The start of HIV is fever, headache, nausea, vomiting, persistent. You treat it, next month is there, next month is there. It's the same with hepatitis B. Those are prodromal symptoms. But now, you now have specific symptoms, which are with respect to destruction of specific organs. Yes. When, for example, the liver itself is destroyed, the liver gives you symptoms like the abdomen is swollen. That's one of the side effects of liver when the liver has failed, and the legs are swollen, accumulation of fluid. Yes. But that same accumulation of fluid can be caused, that swollen legs and the abdomen can be caused by heart failure. It can be caused by kidney failure. So you should not see your swollen legs and swollen abdomen and say that, oh, I have hepatitis or I have liver failure. No. That is why there are so many things that the doctor is going to ask you. He's going to examine you and now know that, okay, maybe these swollen legs and abdomen is more towards liver failure, heart failure, or kidney failure. And then even there, where you get to if you assume that it's a liver failure, in the liver failure, now you start asking yourself, what caused this liver to fail? Was it hepatitis? If it's hepatitis, was it hepatitis B? Was it hepatitis C? Was it the alcohol hepatitis? Was it the drug hepatitis? Then now the doctor is going to ask for a series of tests, with hepatitis B being one of those tests. So the swollen legs and the swollen abdomen are just those are we call them vague symptoms.
Yeah.
Symptoms that they tell you, those are symptoms of damage. But to know the exact cause, you now have to go into the history of the patient, discuss a lot with the patient. For example, if I see swollen legs and swollen abdomens and I see jaundice, I know that this swollen legs and abdomen is most likely the liver, because jaundice will come from the liver. It's not going to come from the heart. It's not going to come from the kidney. But now this is more medicine we are getting into. So generally, the doctor will have to examine you, discuss the history of how the swollen legs came with the abdomen, and then request for tests. And hepatitis B will definitely be one of those tests, unless you have been vaccinated before. He may be like, okay, maybe I will not, because if you are vaccinated, it's not more the normal hepatitis B test, which is called hepatitis B surface antigen. The doctor is going to request for a panel, which is another kind of hepatitis B test. So that is how we look at a client with swollen legs and swollen abdomen, because they are vague symptoms. They are not specific to hepatitis B.
Yeah, thank you very much, Dr. Brandon. And our viewers are glued to their TV. Questions have not really been coming per se, like they usually is something which is educative, and many of them are getting new things today, and what they ought to do to stay longer on earth. And Jesse is having something there for us. Jesse, can we have that for the 1 minute 45 seconds before we pick up to prevention? You're talking about prevention. How can this be prevented? And the message to someone who came to the TV the last time talked about there's a difference between Dr. Brandon and Doctor. Those ones who have those places, all over Dirty South, all over Dongo, and they're there, and go to doctor and take malaria medicine because I feel my body is hot, and the rest, without any prescription. You have words for them.
I'm going to share a story of a client of mine that met doctor after leaving doctor.
Yeah.
And the consequences of that, it was not.
We'll come into that. Words for them, maybe at the end of before we close the curtains of today's edition. Jesse, we have the little stuff there for 1 minute, about 45 seconds. Thank you very much, Jesse.
If you have hepatitis A or B, your liver is inflamed because you have been infected with either the hepatitis A virus or the hepatitis B virus. Your liver is a soft, flexible organ that performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As the blood passes through, your hepatic lobules break down harmful substances. Remove bacteria and worn-out blood cells, and forms clotting factors that control bleeding. After a meal, your liver stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis A, the virus entered your body when you were exposed to fecal matter from a person infected with the virus. You may have been exposed to the virus by eating contaminated food or water, contact with infected feces, such as during a diaper change, or having unprotected sex with a person infected with the virus. If you have hepatitis B, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. When either the hepatitis A or B virus enters your liver, it invades your liver cells and makes copies of itself. In response, your body sends immune cells to attack both the virus and liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells, which prevents your liver from working properly. If you have a chronic hepatitis B infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. If you have hepatitis A, your doctor won't prescribe any medical treatment because your immune cells will eventually find and destroy all of the hepatitis A viruses in your body. If you have hepatitis B, your immune system will usually remove all the hepatitis B viruses from your body. In some people with chronic hepatitis B, particularly children, their immune cells are unable to remove all of the hepatitis B viruses. If you have chronic hepatitis B and your immune system can't get rid of the virus completely, your doctor may prescribe antiviral medication. If you have a severe case of chronic hepatitis B, your doctor may recommend a liver transplant operation.
Thank you very much, Jesse. We have this, before we ask this particular question, good evening to you all. While avoiding alcohol and over-the-counter drugs, also avoid processed food, saturated and sugary food. A well-balanced diet is essential to reduce liver inflammation, fight infection, and improve energy levels. This is from Cometa Mirabel, a nutritionist from Kumba. Thank you very much, Mirabel, for your contribution. Dr. Brandon, this is for you. We talked about food poisoning, which is one of those things you talked about. Madam Maureen talked about it. I'm sure Mr. Sebastian talked about it also. And that can contribute to this whole issue of hepatitis B. We'll talk about poison food or food poisoning. What does it mean? It's frightening. You go for party and some other kind of stuff that I had food poisoning. You are not too sure. There's a distinction between maybe they take maybe something like that which is put for rats to eliminate rats in the house and put in the food, or we talk about that. What do you know? Explain that to the viewers of Mountain Echoes, please.
Okay. Food poisoning is related to hepatitis in two ways.
Yeah.
The first way is that when we use the word food poisoning, local parlance turns it into something else, because they think that they actually poison your food, drop something. Food poisoning just means that you eat infected food. That's what we mean by food poisoning. The food is infected with whatever it is infected with. Now, there you have to go into the details of the cause of the food poisoning. But food poisoning means infected food. Now, how does it affect hepatitis in two ways? The first way is that you can actually eat food that is infected with hepatitis A or hepatitis E. As a video we just watched, you saw that they talked about hepatitis A being transmitted. In medicine, we'll say fecal-oral. That means that either through feces or through the mouth. So if I eat food that is infected with the food is infected, if I eat food that is infected with the feces of, let's say for example, I eat food or drink water, if you go and defecate in a stream and I carry the water and drink and you have hepatitis A, I get infected with hepatitis A. If you defecate in my farmland near my vegetables and I take them and I don't prepare them well, if you have hepatitis A, I get infected with hepatitis A. So that is how you have food poisoning affecting hepatitis. The next way with food poisoning affecting hepatitis is just what Madam Madam Mirabel, I think the nutritionist spoke about, when you already have chronic hepatitis B. Now, without proper balanced diet, if you eat a lot of sugar, if you eat a lot of fatty foods, you can also have, there is fatty liver disease from a lot of fatty food, which destroys the liver, and you end up causing the hepatitis B to replicate. So it's important to note, food does not necessarily cause hepatitis B. Hepatitis B is by bodily fluids, but food will cause hepatitis A and hepatitis E. But food will make hepatitis B to get worse, because improper, poor nutrient food is going to destroy the liver, hence giving room for this hepatitis B virus to replicate.
Yeah, since time is not our friend, doctor, could we just go to the preventive measures and how maybe the treatment goes?
Yes, we spoke about the vaccine already.
Yeah.
We said there are three. I talked about three vaccines. I'm more elaborated on one of them. I'll start with the oldest, the traditional vaccine, which is 3 doses. And how is the interval? You give the first one, the first one, and these vaccines are given intramuscular. Usually give it at the arm, around the deltoid area, that's the shoulder. Now, these vaccines, you give the first one, the first dose. The second dose is given 1 month after the first dose, and then the third dose is given 6 months after the first dose, or 5 months after the second dose. So when we say the third dose is given 6 months after, we are making reference to the first dose. So that's how you give the 3 doses of hepatitis. The side effects when you take you may have small fever, small cough and catarrh. Then the second part of the vaccination I spoke about at 6 weeks, at 10 weeks, and at 14 weeks, which is given to babies in the expanded program. These women that take their children for vaccination, they should know that they have received these 6 weeks, 10 weeks, and 14 weeks.
Okay.
Yes, and the last part is the one that is trying to be implemented now, giving hepatitis vaccine at birth to this February 2025. As I said, it was signed and implementation is coming. That is the prevention method.
Okay, thank you very much, doctor. You have a question here. Good evening, DMRO TV. Can one type of hepatitis B lead to another? This from our phones in Kumba. What is the best food for hepatitis patient? Hepatitis B patients. Yeah.
When you have hepatitis B, you can easily pick up hepatitis D.
Yeah.
Yes. So the answer is partially yes, because hepatitis B where you see clients with hepatitis B, it is very easy for their body to pick up hepatitis D if they get to somebody that has hepatitis D. D loves B so much, so easily attaches to B.
Which kind of food can they eat?
Food for hepatitis, as I said, is vegetables. You just have to live a healthy life. Vegetables, you drink a lot of water, you avoid fatty foods, all this, as the nutritionist said, processed foods, a lot of fatty foods like pork meat, these fatty parts of pork meat that people consume a lot, and so on. So it's practically vegetables and low quantities of saturated fat. That will help you a lot when you have hepatitis.
Yeah, very fast, doctor. You have this. Good evening to you, father, and able doctors in panel. This topic of today has touched me so much. We have many of our young boys and girls who are pursuing maybe religious life and priesthood, and when they are about to start formation, like I'm sure Madam Maureen is going to tell us more on that maybe in another session, they are taken to the hospitals. Where they've been taking them to go to Solidarity Hospital down here for some tests, and it is discovered that some have hepatitis B and are stopped from beginning formation. If one follows his or her treatment well, can he or she be admitted? And secondly, what words of encouragement can the doctors give to some of them who are following up their treatment, still hoping that one day they will get rid of it? Some of them are depressed and disappointed. It's general.
Thank you very much. I'll go straight to the point. If you follow your treatment for hepatitis B, one thing I can assure is that most clients, they need to first of all understand that the important part of the treatment is the preventive. Even if you have been diagnosed with hepatitis B, the lifestyle that you live is the most important part of the treatment. Less alcohol and less drugs. If you do that, you will hardly have reactivation of the virus, and you can live till 80 years. And please, these people should know you can get married, impregnate a lady, she's not going to have hepatitis B, give birth to children that will be hepatitis B free. So they should not think that their life has ended. They cannot. No. As long as your lifestyle is good and the virus is not replicating, you get married, you live a normal life. The virus is almost negligible. You live till 80, 90, 100, 110, and so on. And for the question of if for those who are don't test and if they can be, I think that is more of the core. Yeah. It is the core that has the right to take the decision whether the person is going to
Thank you very much, Doctor. I'm sure maybe Mr. Sebastian, you have for five seconds. What do you tell those who are not too sure of maybe their status about this whole thing of hepatitis B?
To tell those who are not be sure of their status of hepatitis B, first is to get tested of the hepatitis B virus. As Dr. Elia explained, there are two stages: the acute and the chronic phase. Yeah. With the acute phase, you could get the signs and symptoms less than 6 months, while with the chronic stage, it start proliferating after 6 months. So it's just to get tested within this period of time.
Yeah, thank you very much. And Madam Maureen, maybe one word to those who are already in the, having hepatitis B. What do you have for them? You have 5 seconds for that.
Okay, I'll tell those who already have hepatitis B virus that the first treatment is acceptance. Once you accept that for real you have this virus in you and you follow all your medical advice, I think you will live longer, as Dr. Elia explained. Then I also want the public to know that it's good to know your status and get yourself vaccinated. If you know your status today that you are negative and you don't vaccinate, it's not a guarantee that you can be negative for life. The only way to stay negative is to get yourself vaccinated. Yeah. And only at Solidarity Hospital, at Checkpoint, opposite Enamel Pharmacy, that you can get this vaccine. You'll be well received there.
Thank you very much, Madam Maureen. Doctor, you have one word for those who are called doctor. And
thank you. Yeah. Very important. Please avoid. Go to the hospital, meet your medical doctor, ask questions. Please avoid googling a lot. Google can deceive you. Avoid listening from people in the quarter. Avoid listening. If you have questions, go to the hospital. We have many cases where people tell you that, oh, I can treat your hepatitis. Doctor in the quarter will give you some concoctions for you to drink. That will give you drug hepatitis and will make your hepatitis worse. Meet your medical doctor. He went to school for that and is going to assist you any way he can.
Thank you very much, Dr. Brandon. Thank you, Mr. Sebastian, for being with us, and Madam Maureen. May God continue to bless you all, and all those who contributed. May God continue to bless you. JC, thank you, and Mr. Funky Anika, in charge of programs in DMRU TV, Madam Joyce Bong, manager, and Father Solomon Nekundi Lyonga, the director of communications, and to Bishop Michael Bibi, #1 supporter and promoter of our TV. God bless you all. See you tomorrow. Good night.